the paper we're going to listen to now from Olivia. We also have an article. It's currently being edited. The article, the draft or the first version of the article is already online. You can read it, and it will be in the World Sustainable Development Outlook 2020. Olivia, thank you very much for your time. I really appreciate it. You have contributed in the past in many of our conferences, including 2018, I think in Geneva, 19. And this last 2 months, you also contributed to our Global Mind debate. So Olivia, the floor is yours.
Okay. All right. Good afternoon, good morning, good evening from wheresoever you're watching. Olivia, just like Professor Alam has said, and thank you, Professor Alam, for having me today. Talking about the social and economic impact of coronavirus, COVID-19, looking at it from the African continent. Coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. Coronavirus can infect people, and they can spread between people, such as with MERS-CoV, SARS-CoV, which we've had in previous time, and now with the new virus, COVID-19. COVID-19 has triggered a paradigm shift in all dimensions of society, with potentially severe negative impacts on global efforts towards sustainable development. Although the pandemic has affected all sectors of society, regardless of age, class, ethnicity, or nationality, the experience of being isolated or afflicted with the virus and access to healthcare and disease outcomes are heavily influenced by location and wealth. As of this morning, we've got about 14,881,625 cases of coronaviruses. As of this morning, 630,996 reported deaths. About 8,936,004. Those are the reported ones. Those are the ones that are reported. Although there are some that are not reported, we are not able to consider that. Gradually, the novel coronavirus is affecting the African continent. While it seems to be peaking in Western nations, there has been in the last few weeks growth in African countries. And experts are wondering why this is happening. And there's been a lot of myths, concerning the coronavirus among Black people, among, Africans that are okay. Well, we live in a very hot climate, coronavirus cannot stay. So there was a lot of carelessness in that. Who reported that the virus took 98 days to reach 100,000 cases after it was first detected in the continent in the middle of February. However, in 18 days, it rose to about 200,000. The impact of COVID-19 in Africa. The impact of COVID-19 in Africa is first because of its openness to international migration. Thus, it is not immune to harmful effects of COVID-19, which are of two kinds, external and internal. I said endogenous and exogenous. The exogenous effects, which are the external effects, come from direct trade links between affected partner continents, such as in Asia, Europe, United States, the tourism industry, the decline in remittances from the African diaspora, for example, the foreign direct investment and official development assistance, different financial flows, and domestic financial marketing tightening. Then the internal effects as a result of the spread of the virus in many African countries is due to some mortality and morbidity reasons. For example, when we talk about economic activities, when some countries, Kenya, Uganda, South Africa, Nigeria, Ghana, one by one, when they started, they introduced lockdowns in some certain states, in some certain nations. There was an outcry among the people, especially traders. I remember that in Lagos State in Nigeria, when the governor introduced lockdown, the first thing he said was for people to start working from home. But then some could work from home, while some couldn't work from home. Traders who are like drivers, those that are mechanics, those that sell food stuff, those that sell data, those ones cannot work from home. They need the public, they need customers, to take care of them. But then everybody got into lockdown, and there was pandemonium in the sense that, well, we are under lockdown. How are we going to feed? And of course, the government did say they were going to provide food, but then the practicality of that was very difficult. They tried to, but they couldn't reach everyone. And after a week or two, some people started sneaking out. And of course, soldiers and policemen started arresting people, beating some and getting them out, to go back home. And then there was the issue of denial. It happened in Kenya. The African people, they thought, oh, it was a white man's disease. It's not going to affect us. So some people don't even believe that there was anything like coronavirus. They actually blamed the government. They thought the government, was, just trying to punish them for fun. In this other case, I provided an overview of certain African countries, the total cases of people who have had coronavirus in Ghana, for example, about 26,572, about 22,915 recovered, and about 144 deaths. The total population of Ghana is 31,097,968. In Nigeria, we've got 37,225 cases, 801 deaths, 15,333. Now, in the whole of Africa, it's reported that South Africa has the largest cases of coronavirus at 373,628, and total deaths about 5,173. Total recovered cases 194,865, and then with a population of about 59,299,850. Let's think about it. If with that population, if there are no lockdowns and if there are no test and trace systems or an active healthcare system to take care of those that have suffered coronavirus, you can imagine what the impact would be to others. The impact of such measures like the tracing, which basically some are not even cooperating, people have to be physically bundled to the tracing sector in some African countries. Nigeria, as an example, some people have to be bundled into the coronavirus center. Some don't want to even go. Some don't even want their family members to even discover that they even have it. There's this stigma. I don't know where that comes from, that there's this stigma that way. I don't want anybody to know that I've caught it. So people do hide it. So they're not even cooperating with the public health authority. So there was the widespread enforcement of curfews, lockdown, and the cessation of public life, which negatively affected the economy. Now, concerning working from home, there was also an outcry in the sense that there are issues with electricity. Electricity was the greatest problem. How could you work at home when you don't have electricity? How could you work at home when you can't even, get the enough data? There's not broadband, effective broadband, the way we have in the US, the way we have in the UK, how we have it in other European countries. There's no effective broadband. And even when there is, they are subject to variations of light where people have to use generators, and all these things do affect them socially, do affect them economically. No. Well, we said that although the coronavirus does not discriminate in terms of who it affects, there are distinct social demographic trends driving deaths around the world. Many communities in African countries are likely to be severely affected if the threat of infections continues to escalate. Considering the social arrangement of African dwelling places and the limited availability of private facilities, African societies are particularly susceptible to catching the virus. African society, especially in the rural areas, not like the big cities, there are families, you know, a man could have about 3 wives, you know, he could have about 15 children living in a small compound. They all pack themselves together. So there's no way such people could, you know, social distance, you know, effectively. You know, everything they do is, you know, communal. So that's a problem. Like I did say, that in slum areas, individuals must fight for essential resources. You know, there have been long queues, you know, where, I mean, different vans will come with different foods, and then people are, you know, climbing on top of one another to be able to get, you know, this food, you know, during the lockdown. It's a very pathetic. We also, also say one thing, that people also had to share bathrooms, which makes social distancing very impossible. And another problem again in the African setting is the fact that lack of water, even in cities, lack of good water. I'm talking about good, you know, sometimes, you know, for days on end, there in the cities, there's no water, and people have to, you know, source water from other areas. But in rural areas where people are having to drink from, you know, they're having to drink dirty water. So to talk to those people about, okay, having to wash their hands when they don't even have water to drink, it's more or less like this. It's ridiculous. They can't keep it. They can't just effectively social distance. They can't effectively wash their hands because the water is not there. So this is a problem, you know, in Africa. So, like I did say, the challenge thus far has been adhering to these measures. Social distancing measures have its challenges worldwide, just as it starts in UK, that as it starts in US. It affects, activities, you know, things that ordinarily one would have been able to do. You're not able to do it. You're not able to see family members at the initial stage. You're not even able to meet up with friends. You're not able to hug people. You know, everyone is looking on the left and on the right, and we're all confined to one place. But I say again, social distancing has proved to be impossible due to the impact of economic underdevelopment on living standard. You know, the fear, why did I decide to opt for this particular topic? I look at it that, if coronavirus were to hit Africa, a lot of, families are going to be in trouble because we don't have the facilities, you know, oxygen is scarce, you know, ventilation. The doctors, a lot of doctors said they have to, you know, buy their own PPE for themselves. In Africa, they have to source for their own PPE. You know, some private hospitals just closed up. You know, they just closed up because they didn't have the equipment. They just shut down during the lockdown. So the problem, you know, with the African situation, apart from the fact that there's no electricity, there's no good, you know, the drugs, you know, some of them do get drugs, you know, regularly, you know, from Britain, from America. But since the airports and a whole lot of, avenues whereby they could, bring these things into the markets, where they could bring all these things into the country, where shut down. There was a problem of that, and there was a lot of panic. And besides the issue of COVID-19, you know, people that had high blood pressure, that had diabetes, especially a lot of the elderly, you know, some of them couldn't go to the hospitals because people were being turned away. People were not allowed, you know, to really go out, so they had to stay in their homes and look for other means. But having said that, the positive aspect of this is that Africans rely so much on herbs during this period. You know, they were able to, look for, you know, think about some certain kinds of leaves, you know, they believe that they were healthy, you know, they look for some certain kinds of balms that believe that people should use, you know. They devised different means of looking after, themselves, or protecting, you know, themselves. You know, during this period, there was lemon, there was garlic, there were different things that they did themselves. And as lockdown, you know, began to ease, you know, the fashion designers also, started making masks, like I said, there were some positives, homemade masks, they started making homemade masks in different designs, in different prints, and started selling it out to people. Also, in Ghana and Uganda, there were, you've got manufacturers that started manufacturing hand sanitizers. Usually they would have depended on, maybe China depended on getting supplies from overseas. They started manufacturing their own stuff. Even in Ghana, they started making their own PPE. So there was a positive aspect, to this COVID-19, affecting Africa, because they were able to look inward and develop some things for themselves. Now, I said, unlike Westerners, most Africans do not have recourse to mobile transaction, as the prevalence of e-commerce and online banking is very low. During the pandemic, some of us were able to, get monies, transfer monies in between, maybe from one account to another, maybe do a whole lot of other things that it's very, very rare, during this lockdown. Not because it don't exist, but not every person, that's in Africa has access to online banking to be able to make transactions. And then when it comes to also, apart from financial transactions, people that are mainly affected also are those in the rural areas, especially in the areas of schools. Because when this happened, schools were closed. Primary schools, secondary schools, universities were all under lockdown. And some lecturers were able to teach students online, while those in the rural areas, could not even benefit. And that was where the divide, really, the inequality, became an issue. Because those, in the rural areas, one, they don't have access to light, they don't have access to the internet. For example, in the Nigerian case, for example, I like to use a case of Nigeria, because I'm also in Nigeria, but I live in UK. I like to use the Nigerian case, for example. It was reported that in Nigeria, for example, that 1 in every 4 persons have access, to digital, transactions using the internet. Whereas 3 out of those 4 people do have access to a mobile phone. But there's a limit to what mobile phone could do that laptops, would do better. So when it comes to education, some children were obviously deprived of education, not because they don't want to go to school. They can't go to school. At the same time, they also cannot receive tutorials online because they don't have access to such information at all, to such facilities. Most of the daily activities that power African economies are concentrated in open markets, where dealers engage on close physical interaction. Like I've said earlier on, trading, market women, we talk about, mechanics, we talk about people that, it's more of, trading, physically. It's not like online where people can sit down and, you press a button for delivery from Asda, or press a button for delivery from Amazon. It doesn't work like that. In most African countries, it doesn't work like that. So which is a difficulty for most people. Then African cultural norms discourage social isolation. Look at it when when countries were put under lockdown, people were not allowed to, visit the mosques. People were stopped, visiting the churches. People were stopped, going to synagogues. And, these are, this kind of arrangements, the religion and culture, it's very, very, very important to African citizens. As to find out that the pandemic has to stop this, it's more or less, emotionally, traumatizing for Africans. Africans also, they like to do things together, have family meetings, either on Sundays, on Fridays, on Saturdays, or have celebrations of one thing, or the birth of a child, or the death of different ones, or wedding, but throughout, such gatherings were prohibited, which basically, those things have never really happened before. Seeing a whole lot of people, together, but you can't see them together. Socially, it does, have a ripple effect, on the African psychic at the time. The economic impact of coronavirus in Africa can be very damaging due to the limited ability of people to survive without income. It is true that staying at home and working from there is an effective means to reduce the coronavirus from being spread. However, achieving this ideal is next to impossible in many parts of Africa. A major problem is the level of ignorance among the slum dwellers. That's my conclusion. That why is it that way? Most of them, they don't want to observe the virus control measures. In fact, some of them believe that the coronavirus is not as bad as poverty. They believe that the coronavirus is not as bad as corruption, and some of them have blamed the government, for coronavirus. They believe that it is fake, that it does not exist. So so observing the distance, they don't even want to observe it at all. So some of them are, having to fight officials over it. Then at some point, it may be advisable for residents, to have a dialogue about what are we going to do, in the midst of this pandemic. Of course, communities are, there were different community initiatives, even in the African diaspora. There were some initiatives that were put together to support, at least I know of two of them, that were put together to support, women, basically, some certain women in Nigeria during this COVID-19, which included, not only money to buy food stuff, it included clothes for children, just to look after these women. Then the healthcare systems. The healthcare systems in Africa have always dealt with severe challenges. Yeah, we remember the issue. We remember AIDS. We remember Ebola. We remember swine flu. We remember different kinds of flu that, even despite the fact that the brain drain, despite the fact that some of the medical doctors have left Africa, the ones that are still available, they did their best to make sure that they contain this. And I said, it is clear that governments have not been heavily investing in healthcare, and this is what the coronavirus has shown, because it was such a panicky situation, because some of the government officials that were used to medical tourism, going abroad for treatment, were not able to travel to Germany, were not able to travel to India, or come over to the UK. And it's clear that governments they've not invested in healthcare or medical research. They've not invested in protective equipment and other medical apparatus. They've not also, built more, hospitals, or invested in technology, or invested in, electricity, things that would, ordinarily, make it much more easier for, people to sustain, themselves. So I believe that maybe this could be a wake-up call for the government, for individual communities, for professionals, to kind of work together and do things differently in the future. Because even the African diaspora that sends remittances, just like the other lady had said, my other colleague had said, she said a lot of Black people in Africa, in America and UK and even Italy, some of them have died of COVID. These are Black people that have died of COVID. And if people have died of COVID, you can imagine, like, if, let's say 50 people have died, and these 50 people, maybe every month, they send in about $200 every month, and they have died. That would affect, obviously, the income of their families back home. So it's both ways that we've got to look at it. That how do we move in, from from there. Thank you. I'm open to any
Thank
questions.
you very much, Olivia. Thank you very much. Wonderful presentation. If you can click on stop the sharing so we can get you all of you there. Now, that was very, very good presentation. And Olivia, first of all, let me congratulate you and appreciate you, and also Dr. Shadia the same. You have used almost all your references are 2020, which is something really in academia we very much appreciate it. I can see that even when I looked at the paper, almost all your references are from 2020, 2020, which is, that means you are up to date with everything you presented, which is very good. Now, the first question I have here, I have a question for you in the chat. I will ask you and Shadia, Dr. Shadia. My question is, you have shown in that table the number of cases in Africa, selected African countries, because I think you showed Nigeria, you showed Sudan, you showed South Africa and others. But the first question is, South Africa is so much different, 300-something thousand, completely different from the rest of Africa. And even yesterday or last night when we were watching the news, they said they are testing the vaccine now in 2 big spots. One of them is South Africa, one is Brazil. So the first question, why South Africa is so out of the curve completely, 300-something thousand? The second question from that table, the table does not just show the selective countries' cases, but it shows some indication to findings. For example, in Nigeria, you have 37,000 cases, only 800 people died. And in Sudan, you have 10,000 cases, 600 people died. So if you compare the 600 to 10,000, is far away from 800 people to 37,000. So why, these are just 2 examples from Africa. Why it is so, the results or these findings, does they give you any indication of something? Are these maybe the accuracy of the data, or maybe we are doing things completely out of collaboration or coordination? This was mentioned earlier, and yesterday. People in Africa or in developing countries, they do not collaborate, they do not coordinate their work. That's something also mentioned earlier. If that's so, why that's so divergence in the number of cases, in the number of the results?
Right. In the case of South Africa, for example, like you are right, South Africa is actually different. South Africa is made up not just only of the original South Africans, it's also made up of, I don't want to use the word European South Africans, but it's made up of 2 different breeds. It's more or less like there's certain places in Africa where you have the divide, in South Africa where you have the divide for these places, these areas for the Black people, these areas is for the white people, So those ones are much more, in tune, with what is happening in the Western nation. And so they are able to use some of their hospitals are first class, state of the art. The universities are state of the art, compared to some of the other African countries. They're already working on a vaccine as we are speaking now. So they are not basically on the same level. They are much more advanced in technology. They are much more advanced in science compared to all the other Africans, either Nigeria, either Ghana, or either Sudan. And the statistics, because I said if I were to leave, we've got 54.
But Olivia, just one question. Despite the fact South Africa is so advanced and they are much better than the rest of Africa, the question is still they have a very high number of deaths.
Yeah, they have a very high number of deaths because, remember what I said is that, South Africa is a go-to for a whole lot of places. The same way they go to UK, the same way they go to US. For some people, they have a high number of deaths because just like UK, Italy, Brazil, they have a high number of deaths because people, mass population all over the world also go to South Africa. People go to South Africa for holiday. They go to South Africa for tourism. They go to South Africa for, I mean, different kinds of people. So that is it. I mean, if you go to any of those agencies, towards summer, they are marketing either Kenya or Joburg. You know, they are marketing all these other places for people to go to. If that makes any sense, yeah. If that makes any sense.
And just continue on that other part regarding the indication of the results, like 800 cases, deaths out of 37 cases, 1,000 cases, 600 in the case of Sudan compared to 10,000. So if that's each country approach, do you buy into that idea? We are not collaborating, we are not sharing approaches?
Collaborating is not there. Collaborating is not something that we do properly. We are more, instead of collaborating, we compete, you know. I mean, either consciously or unconsciously, we compete. We're trying to outdo one another. We don't do that well as Africans, unfortunately. And remember that even, like I said, we're about 54 countries. We do things differently. We don't speak the same language. We have, you know, I mean, our culture, our attitude is different. And of course, we're going by data, but those are, like, remember one of the things I said is that is reported data. There are a whole lot of things that are not reported. So there are missing gaps. Those are just estimates. You know, those are estimates. So those are estimates,
My question to Dr. Shadia and Dr. Olivia Joseph, we have followed through the media the news that the British government is supporting the private sector for 55 million. And this support may include the entire population without screening the population or the groups affected by the corona pandemic, which means the employment, whether of color or white, so you mean black or white or ethnic minority, has benefited from the support. Any confirmation of this news? But I think the question is really not any confirmation, but if you know about this.
I mean, let's, think about it. This is a capitalist society, and it's more of, you know, profit, profit, profit. So the government wasn't prepared for the pandemic at all, so it caught them by surprise. So when eventually, when it was something of more of a China thing, and it was more or less like, okay, people were not going to Soho to go eat, and then gradually it got to the UK, and bam, everyone went under lockdown. But one of the things that I remember that the government did was that to contact, you know, I mean, each household, they sent in letters to each household to explain why the country is under lockdown, and that they would keep them informed. Now, those that had underlying health conditions, and that's one of the things about Black ethnic minorities, you know, I mean, some don't make use of the health services, so some don't even have GPs, and it could be due to the fact that it could be due to migration issues. Some have moved and they didn't inform, you know, their GPs. So they had, I mean, maybe, for example, they had diabetes, but no GP is writing to them. Well, GP wrote to the former address, but because they've not been visiting the GP, so they didn't get the help that they needed to get. You know, some of them, you know, are not even working. They are not registered. They are undocumented migrants. Because one of the things that the government did was that, you know, I mean, the people that had underlying health conditions, they said strictly don't go out. You know, we make arrangement for your prescriptions. If you're under, I mean, if you're on any medication, we'll make arrangements for food, which included, you know, a weekly shopping. We were living at different households, spending money, you know, dropping these monies to whether you are blue, green, yellow, or brown. They were actually dropping that money. But there's so much that the government has not prepared. No government, I mean, the pandemic took the whole world by surprise. And again, you know, I mean, it's more or less like, okay, what are the lessons learned? Is what, I mean, us as the Black community should be, I mean, looking at. Where are we investing? What should we be investing in? Okay, they said, okay, well, there's the issue of, okay, we lack vitamin D. There's nothing that we can do about it. But I tell you what the problem is. The problem is not so much as whether we lack vitamin D or not. But the problem is so much as, systematic racism, wherein you find out that either Black, Asian, or ethnic minority, you do 2 times, 3 times, sometimes much more what your average colleague has to do. It happens every other time. And you find out even, nurses will tell you, doctors will tell you as front care workers, if you go to A&E, you find out they are filled with people, minority ethnic groups. So those ones are exposed, they do frontline work. A lot of us are in frontline work. Not because they push us there, but that is what is available. We get there. Maybe we love to reach out to the public. That is just our job, either as drivers or as permit. So that's the kind of job. So because it's a kind of disease that affects women, it's a physical contact, we can't be immune. But the problem, and I believe the challenge for the government is, well, they didn't provide the necessary equipment to protect lives at this time. So I look at it more as a lesson learned. I remember I was saying to someone that, okay, now the government didn't provide PPE. You're a Black ethnic minority, you are prone to this. What should you do? Get your own PPE, get your own salary, protect yourself before anybody protects yourself. Protect yourself, protect your family. Well, this may not be common, but at the end of the day, I believe that, this has to start, from us. Nobody can take care of yourself much more that you can take care of. And I say what I'm saying to our Black ethnic minority folks, no one can take care of you much more. As a community, we've seen what's happened. We've seen Black Lives Matter. We need to do much more for ourselves. Of course, the white people will look after themselves, first of all, because it's like, English jobs for English people for starters, and that's the whole of Brexit. I don't want to digress. But then we also, as a Black, Asian minority ethnics, as a group, we have to look at what works for us and make sure that we don't become, how would I put it, victims, whatever happens. Thank you.
Okay, thank you very much. Any question from anyone? I have looked at the chat. Yes, Dr. What's her name, Dr. Yes, Dr. Abdurrahman, do you have a question?
Yes, please.
Yes, go ahead. Yes, they are listening to you. Yeah, go ahead.
Yeah, if you will, please. Since you are a lawyer, Mr. Olivia, and we are following the effectiveness of the COVID-19 on the judicial sector and advocates and lawyers over the world. What about that in UK in particular? Okay. And how is it reflects regarding the proceeds and the working in the course and online? What about the maturity of the internet regarding the online working of the course and the advocates? This is the one. Next, as I know, in UK, they are working in the sector, in the social sector, on a model of social impact bonds. This is a type of social contracts used for supporting society, for the community. What about the impact of these contracts in this pandemic, in this COVID-19? Thank you very much.
Okay. Are you, Olivia, are you familiar with these contracts you mentioned before we lose him?
Okay, right. The first question, I can answer the first question, but I'm not very familiar with the second question.
Okay.
About the law, the judiciary, and how the judiciary is operating, it should be interesting to know that the government did not classify the work of a solicitor or a barrister as a key worker. So the law firms, when the countries, went under lockdown, law firms had to close their offices. Now, the second question is that what would happen to those law firms. Yes, they were working from home. Those that could work from home were having, online conversations and online interviews and Skype with their clients. But court cases were still going on. How were court cases going on? Court cases were going on through Skype meetings, through Microsoft Teams. Hearings were going on. People were being convicted. People were being acquitted. So life was still on. It's just that the judiciary had to find another means of operating, if that makes sense, without a physical face-to-face with litigants, or face-to-face with judges, or face-to-face with other barristers or other members of the bar. But they still have to find, because remember that sometimes cases, it'd be interesting to know that cases are listed, it could be listed 12 months in advance. So, and no one knows that this pandemic was going to obstruct. So life has to move on. So the cases were, going on. And some jobs, of course, obviously not all lawyers were able to meet with their clients, depending on the kind of professions, but definitely work was still going on. Immigration cases were still going on. Family law cases were still going on. Safeguarding criminal law cases, they were still going on in between courts, and exchanges between the Ministry of Justice and barristers, laws, solicitors, they were still going on. It's just that the digital technology has made it much more easier, for people to, for barristers and solicitors to be able to exchange views, to exchange ideas, and reach conclusions on existing cases.
Okay, Olivia, thank you very much.
بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد MENA، بلاد MENA.